I want to start out by clarifying that it's difficult to talk about any category of medications as a whole, because within every category there's going to be individual medications that have certain variations. But in general, when we're talking about medications for depression, we're talking about antidepressant medications that are used primarily to treat depression and anxiety disorders. The key thing to understand in terms of how long you have to take the medication is, first, these medications, unfortunately, can take from 6 to 8 and as long as 12 weeks to fully kick in. And if you don't understand from the beginning that it can take that long, it can be very frustrating, and unfortunately, many patients will stop the medications right about the time that they're just about to start working because they didn't understand that they need to give the medications a full length of time before they start working. Admittedly, we don't fully understand why the medications take so long to work, but we do know that studies have shown again and again that even people who don't have benefits from the medications after taking them for 6 weeks or 8 weeks can get benefit just a few weeks later if they stick with it. So the first thing to understand is that you should stay on your antidepressant medication for at least 3 months before you decide that it's not working. The other side of the picture is, once the medication has worked and you're feeling better, how long do you have to stay on the medication? There's no simple answer for this question either. What I tell my patients is, as a rule of thumb, be well for 6 months before you start thinking about coming off the medications. And the reason for that is depression takes its toll on the brain. And in my view, you do need to allow time for the brain to heal so that you don't get depressed as soon as you come off the medication. And different factors will influence what time makes sense, and this can be best done by having a good working relationship with your psychiatrist. But as I said, as a rule of thumb, start the clock from when you start feeling well, and then after 6 months you can start a discussion about when it makes sense to do a trial off of medications. Now, if you've been through a few trials off of medications and you've gotten depressed each time, in general, once that's happened twice, it's usually advisable to then decide to stay on the medications. So certainly there are people who get depressed, get on treatment, get better, and then come off the medications and are fine. There are some people who will get depressed again but can go through that cycle again. But once that's happened 3 times, it's advisable to stay on the medication. But again, that's an individual decision that each person should make with their doctor.